think given the participants, it highlighted the complexity of the Ontario situation. There are so many different stakeholders who've got a legitimate say in this area that the kind of coordination or lack of coordination currently is perhaps unsurprising, but that I think also highlighted the challenge that we face about how can we make this a more responsive and streamlined approach to using evidence in Ontario. So I think there's a number of things I'd suggest. The first is we're interested in trying to promote the use of evidence by citizens and healthcare professionals and managers in Ontario, and we have really bad access to evidence. So I think one of the first things we have to do is think about what is the knowledge infrastructure that Ontario requires to ensure that just access to knowledge isn't a key barrier. So that's one. The second would be, can we develop a better coordination across these different groups, all of whom at the moment feel they're part of the puzzle of quality improvement, but probably are approaching the healthcare system with a kind of cacophony of voices and different approaches, which if you're a poor healthcare professional in the field or a manager, must be kind of fairly overwhelming. So can we coordinate better who is doing what and try and minimize the noise in the system? And can we also start to develop more shared approaches so that when we're working with the system in health in Ontario, that we're not constantly producing a new model or a new framework that is just kind of confusing the system. We've just got used to this, and then someone comes from left field and says, oh, now we're going to do it this way. You know, can we sort of, again, just coordinate the content of or the approaches we're starting to use?